collaboration and say once again that we will face this crisis together as Canadians and we will get through it
And I would like
together.
to thank the opposition for the collaboration and say once again that we will face this crisis together as Canadians and we will get through this together.
Thank you very much, Pablo.
Okay, you know the drill. One question, one follow-up. Rachel Haynes, CTV.
CTV. My first question is for Minister Rideau. When did you first know and first briefed about the coronavirus threat, even when it started in China?
It would be hard for me to precisely give you a date. I can check back and we can give you a date on the first briefing, but it was extremely early January. I would say probably around the 10th or so that I had returned from my own vacation, and I was briefed at that time that Dr. Tam had been observing a cluster of very unusual activity in Wuhan and was quite concerned about what that might represent in terms of future developments.
And Dr. New, there have been a number of concerns about the backlog of results and the cases of community spread. Even here in Ottawa, the public health officer saying that there could be number up to 1,000 people who are infected right now. How many people right now do you believe are infected with COVID-19?
That's a difficult question. I really can't speculate or conjecture. We do know that our best efforts are being put forward at all levels of government, the federal government, provincial and local, to make sure we get testing available, have access to as many people as possible, because we want to actually have the most accurate picture of what's happening in our communities. So at this point, I don't think it's useful to speculate on how many people might be having COVID-19. We'll base our results and the way forward on the test results, and then put our best foot forward in terms of the public health actions that need to follow.
But if there's the backlog, how can you know?
Please, Rachel. Louis.
I can take a shot at answering that as well. We are not only obviously watching the numbers of new cases, but the numbers of deaths and where those deaths have occurred and in what context they've occurred. So, for example, we know that I think 9 of the deaths that we have, I think it's 9, occurred in one single nursing home in the Vancouver area. That is important to understand, because it isn't that we're seeing deaths accelerate in an emergency room. It's not to say that we won't, and that's what we're trying to work so hard to prevent. So when Dr. New is saying it's hard to speculate, it's because the data is different depending on where we are, and the measures that we're taking will actually influence what Dr. Tam has called the attack rate, how many people will actually get sick.
Maybe I can just add to that is that we're pulling out all the stops at all levels of government too, in terms of testing technologies, getting access to more test kits and so on. So certainly at the present time, you indicate there might be a backlog. We're working to deal with that.
People not listening to your advice about social distanciation. Police has to intervene. We see pictures on the social media, people filling up parks, don't really seem to care. What's your message to these people? Monsieur Rodriguez, vous voulez ajouter quelque chose en français?
You want to add something?
Well, I think I had some pretty strong words yesterday, and I would stand by those words. I would say that people need to take this seriously, that various different levels of government have various different quarantine acts and measures that could include up to and including financial monetary penalties and, in some cases, arrest. And provinces and territories and the federal government will be using the tools that they have to ensure that people comply. What we would like to see, obviously, is Canadians to comply willingly in the spirit of generosity towards their citizens. We understand this is hard for people to understand who are in an area where maybe they don't have even one case yet. But people need to understand that what protects them from having one case is the behaviors they're choosing today. So I mentioned walking outside, and you mentioned being outside in various different settings. We're not saying that people shouldn't go outside unless they are symptomatic. If people are symptomatic, they have to stay in their house and stay in their room and not interact with other healthy people or asymptomatic people. That is all cases, all the time. There is no exceptions. If people are not symptomatic and are feeling fine, it is safe to go outside. But even then, they should be practicing, maybe we should be calling it physical distancing, staying 6 feet away from people, making sure that you're not crowding people. I heard reports of people walking on the seawall, for example, in Vancouver yesterday. But I think every region and every province is having examples of this. This is very serious. And just because you're not feeling the illness, or you don't have necessarily in your community even one case, what we're trying to do so diligently together at all levels of government is prevent this disease from spreading towards other communities. And everybody has a part to play in that. So, I will reiterate what I said. It is essential that people are following the advice of public health, and the advice is getting stronger and stronger. And with that stronger advice will becoming more and more penalties if people don't listen.
Je dirais, s'il y a encore des gens qui ne prennent pas ceci au sérieux, à ces gens-là, je leur dirais, si vous ne le prenez pas au sérieux pour vous, prenez-le au sérieux pour les gens qui vous entourent, pour les gens que vous aimez. Et je pense que jamais dans l'histoire de l'humanité, le comportement d'une seule personne aura autant d'impact sur les personnes qui l'entourent.
Sur le Parlement qui revient cette semaine,
les mesures ont été annoncées au cours de la semaine dernière. Est-ce qu'il n'y aurait pas eu une façon peut-être d'agir plus vite? Qu'est-ce qui nous empêche peut-être d'avoir siégé cette fin de semaine même pour adopter ces mesures-là? Est-ce que c'est les rouages? Qu'est-ce qui fait qu'on n'a pas pu agir?
Il faut que le projet de loi soit prêt. Donc, ça prenait un certain délai. Et le dépôt et l'adoption d'un projet de loi est absolument nécessaire pour les types de mesures que l'on met de l'avant. On fonctionne de la façon la plus rapide, la plus urgente possible. Et c'est pourquoi, ce matin, j'ai écrit au président de la Chambre, lui demandant de rappeler la Chambre. Il a accepté dans les minutes qui ont suivi. Et on rappelle la Chambre pour mardi à midi.
My request in the minutes that followed, and we're reconvening Tuesday.
You just talked about the fact that there could be stricter penalties at a federal level, and right now there seems to be a patchwork across all the provinces. Today, for example, Nova Scotia announcing stricter penalties there. What is it going to take? At what point are we going to see more severe penalties on a federal level, and what would that look like?
Well, I already have at my disposal the Quarantine Act, and we're looking at a number of ways that we can make sure that we have stringent requirements of the Quarantine Act for people who are returning to Canada, for example, from spring break or the snowbirds that are returning. Let me be perfectly clear. We will use every measure in our toolbox at the federal level to ensure compliance. This is of utmost importance, and I will speak directly to those people who are returning to Canada from March break or the snowbirds who are coming back. When we say that you must stay at home for 14 days, that means you stay at home for 14 days, that you do not stop for groceries, that you do not go visit your neighbors or your friends, that you rest in your house for 14 days, no exceptions. If you are returning to a household with other people who have not traveled, then you rest in isolation from those other people. You stay in your room or in a basement or in an isolated area away from the other people in your family. It is critically important, especially for those returning home now, to ensure that they follow this public health advice that we're giving them. And the advice will be not just advice. If we need to take stronger measures, we will.
Specific, you've talked about how you're going to make it more crystal clear for people getting off cruise ships, and like you said, the snowbirds coming back. But I think it's important for them to know what could be coming if they don't take these measures. Like, what specifically are you talking about here?
Under the Federal Quarantine Act, which has jurisdiction over international borders and travel and not necessarily interprovincial travel, we have measures that could include monetary penalties up to and including criminal penalties.
Okay, we'll switch to the phone.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur l'étoile 1 maintenant pour poser une question. There will be a brief pause while the participant register for questions. Il y aura un court délai vous permettant de vous enregistrer dans la file d'attente pour la période de questions. Thank you for your patience. Merci de patienter. We have a first question from Kristen Doby. Notre première question est de Kristen Doby from the Globe and Mail.
Hi, good afternoon. Minister Rodriguez, could you comment on how the government is reorienting resources, if at all, to deal with the surge in EI applications?
Will be explained during the debate on Tuesday, and of course, things that will be explained in the bill that I cannot talk about at this moment.
The Prime Minister was asked about this at the press conference this morning, but wondering if you can speak at all to other steps the government is considering in response to wage pressures that businesses are facing.
Well, I mean, as you saw with the measures that we presented last week are touching everybody, all Kenyans, we said it very clearly, we don't want to leave anybody behind. We have measures to help people that have access to EIs, to measures for people that don't have access to EI, measures for people that have to stay home because they're sick or they have to take care of somebody, as well as measures for small businesses. So this is a first phase, and we've been very clear. This is a first phase to stabilize the situation. It's not even, starting to relaunch the economy. That's going to come after, and we think that these are necessary and very inclusive steps to help all.
Okay, next question.
Thank you. Our next question is from Helen Buzetti. Notre prochaine question est de Helen Buzetti du Devoir.
Oui, bonjour, Monsieur Rodriguez. J'aimerais que vous nous passiez un petit peu en revue le déroulement de la journée de mardi. D'abord, vous ne nous avez pas donné la répartition de députés et vous ne nous avez pas non plus dit ce qui va se passer du côté du Sénat. J'imagine qu'eux aussi doivent adopter le projet de loi. Est-ce qu'eux aussi vont faire ça en groupe réduit et ça va ressembler à quoi?
Au niveau de la Chambre, ça va être une trentaine de députés. Il va y avoir 14 libéraux, 11 conservateurs, 3 députés du Bloc québécois et 3 députés du NPD. Alors, c'est un débat ça va durer au total environ 4h30. Il y aura une période de questions, mais pas comme la période de questions traditionnelle, c'est-à-dire qu'on va le faire à travers un comité plénier. On veut s'assurer que les différents partis puissent poser les questions nécessaires. Il y aura des ministres présents pour répondre aux questions. Et le tout, tel que conclu entre le parti, prendra fin à la suite de ces débats-là, donc à peu près 4h30 après le début. Le lendemain,